choosing a medical weight loss program, wow, that's a big decision and it's a really personal one. So today, we're going to build a clear framework, a kind of toolkit, to help you cut through all the noise and find the path that is genuinely right for you. You know, if you've ever started looking into all the different programs and plans out there and just felt your head start to spin, you are definitely in the right place. That feeling is super common, and it's exactly what we're going to tackle today. So, look, our goal here isn't to tell you what to choose. Not at all. It's to give you the right questions to ask yourself so that you can feel confident finding a path that's truly yours. Okay, let's start with what is probably the single most important idea we're going to talk about. When it comes to weight loss that actually works and lasts, there is no magic bullet. There's no one-size-fits-all solution. And that's really the core of it, right? Your journey is unique. Your body, your goals, they're all unique to you. So it just makes sense that your plan should be too. The programs that work the best are always the ones that are tailored specifically to the individual. So what are the options out there? I mean, really, before you can make a choice, you got to know what you're choosing from. Let's get a clear look at the main categories of programs available. Generally speaking, you can think of medical programs as falling into two main camps. On one side, you've got supplement-based plans. These often use something called ketosis, which is just a fancy word for getting your body to burn fat for fuel, along with other helpers that don't require any injections. Then, on the other side, you've got medication-based programs. These use what are called GLP-1 injections, which are hormones that do an amazing job of helping control appetite and blood sugar. So this table kind of shows what that looks like in the real world. A program like TurboTrim, for example, is all about ketosis and supplements. It's perfect for someone who wants to see results without any needles. Then you get into the medications. Semaglutide is a powerful GLP-1 that's great for appetite control, often a really good fit if you have diabetes or a good amount of weight to lose. And tirzepatide, well, it goes even further, targeting two different hormones for a really powerful metabolic effect. You can see how each one is designed for a different need. All right, so now that you know the landscape, let's bring it back to you. We're going to walk through 4 really important questions. Think of them like filters that will help you sift through the options and find what truly makes sense for your life. This one's the big one, the first filter you should apply. Your personal goal is a huge factor in figuring out what level of support you're going to need from a program. Yeah, the program's intensity really should match your goal. You know, if you're looking to lose, say, 10 to 30 pounds, a supplement-based plan or maybe a starting medication like semaglutide could be absolutely perfect. But for more significant goals, or if you have some underlying metabolic stuff going on, stronger medications like tirzepatide are often recommended because they just offer more robust support. Okay, next filter, and this one is a non-negotiable, your personal health. The right program has to work with your body, not fight against it. So the key is just being totally upfront about your health. For example, if you have diabetes, GLP-1s can be a total game changer, not just for weight, but for improving your body's insulin response. If you're a new mom, don't worry, there are safe options out there. And your diet, whether you're vegetarian, vegan, whatever, a good program customizes its plan to you. It doesn't try to shove you into a box. Question number 3 is the practical one we all have to think about, money. But it's really helpful to frame this not just as a cost, but as an investment in your health for the long run. And there is usually a difference in the financial investment. Your supplement-based plans, they tend to have a lower price point, making them a bit more accessible. The injectable medications are a bigger investment, for sure, but a lot of people find that the trade-off is worth it for potentially quicker, more significant results. Of course, the exact numbers are always something you discuss one-on-one in a consultation. All right, our last question, and for a lot of people, this is a big one. It's totally 100% okay to have a strong feeling about this one way or the other. It really just comes down to your personal comfort level. And you know, the best part is there are fantastic options no matter how you answer. If you're thinking, no way, needles are not for me, that's fine. Programs like TurboTrim are designed specifically to get great results without them. And if you're open to it, it's good to know that these weekly shots use really, really tiny needles, and most people are surprised to find out just how easy it is. So you've asked yourself these questions. You have a better idea of what might work for you. So what's the next step? Let's pull back the curtain on that first consultation, because just knowing what to expect can make it so much less intimidating. A good first visit is really just a simple, structured chat. It starts with going over your health history and your goals, then a quick physical check. Then comes the most important part. You and the provider choose the best plan together. And you don't just leave with a pamphlet, you leave with your actual plan and everything you need to get started. And that whole thing? It's not some huge, long ordeal. We're talking 30 to 45 minutes tops. It's designed to be efficient and focused, to get you on your way without feeling rushed. So, we've looked at the different types of programs, we've gone through the key questions to ask yourself, and we've peeked inside that first visit. Let's wrap this all up with the single most important takeaway from all of this. This is everything. Success isn't about trying to force yourself to fit into some rigid cookie cutter plan. It's about finding a supportive, medically sound program that actually fits into your life. And so that's the final question I'll leave you with. Using this toolkit we've just built, what does that right path really look like for you? The answer to that question? Well, that's the first real step on your journey.